diabetes piece there being number 2. I was at an event a couple of weeks ago presenting on obesity as a chronic disease, and I was there with a doctor who was presenting. She was a specialist in diabetes and obesity management. And so, you know, I try to do the right things with my life. I try to eat healthy. I try to exercise, get my sleep, limit my alcohol consumption to the weekends, not smoke. And most of my friends do the same. One of my friends, she's in her later 50s. She was diagnosed recently with type 2 diabetes. You look at her, you would not think the bias around type 2 diabetes, and I speak to that because that's 90% of diabetes claims, that she would have diabetes because you think it's, you know, people that are lazy or not looking after themselves. So I talked to the doctor after and I said, like, is this just inevitable? Am I going to get type 2 diabetes no matter having done all these things? And she said she has a lot of patients that come in that are older females, you know, later 50s, and thanks to menopause, you get this accumulation of belly fat, and that puts you at a higher risk of type 2 diabetes. So these women are quite devastated when they find out that they have this. And she says to them, you've done all the right things to help delay the onset of type 2 diabetes. So you've done the prevention pieces. And you're on one medication. She said a lot of her patients are on 4 and 5 medications. So when you look at this list and you see diabetes, there's a lot of connection there with the cardiovascular drugs that you're seeing, the mental health drugs that you're seeing. And so if you're targeting a wellness strategy and you're, you know, supporting employees who are living with diabetes, you're probably going to see some reduction in your costs on those other pieces.
Absolutely.
So before I get into what you can do